West Streeting, the Health Secretary, is looking at paying, well, bonuses and pay rises as a reward, not a right, to NHS bosses, but also basically saying you are going to be paid less if you fail. Looking at £45,000 temporary pay rises to law bosses to the worst performing areas in NHS to get them to take over, and bonuses of up to £30,000 for those who perform well. But you could actually see your pay cut a little bit if you don't perform well. I would have thought you should just not be in the job if you're no good at doing the job. But I'm old-fashioned like that. Let's talk to Martin Gower about this. He's a former NHS Trust chairman and joins us now. Morning to you, Martin.
Good morning, Julia.
First of all, when you were a Trust chairman, would you have been getting the bonus or having your pay cut, do you reckon?
Well, Chairman, we're really very poorly remunerated. We were non-executive. But the Remuneration Commission, which I used to chair for both my trusts, we certainly did award bonuses to executives. And we were encouraged to do that, rather, because every time a chief executive earned more or was at risk of earning more than the Prime Minister, we had to apply to the Treasury to get permission. And the answer generally would be, well, give them a bonus scheme. And of course, they were never pensionable. I mean, they were not added to the pension. But there's a really...
It was basically a way of hiding. It was a way of hiding the pay rise, wasn't it?
Well, it didn't hide it because it had to be published in the annual report. So anybody like the local media who wanted to find out how much the chief executive's gross earnings were.
I don't think people mind their local NHS Trust chief exec or whoever earning a good whack if they're doing a brilliant job and everyone gets seen quickly and you've got a lower death rate and people are healthy. I mean, works for me. What amazes me is that there needs to be any incentive to any of these people to do their job properly and well. It seemed to me it's immoral. If you're not good at running a hospital and getting the best out of your staff and saving lives, I think it's immoral for you to be in that job.
Yeah, I mean, Julia, I came out of the private sector, out of the wonderful local newspaper industry, which I worked in for many years, into the NHS. God knows why they wanted me, but I've been trying to work that out ever since. But I was used, obviously, to getting bonuses as a managing director of newspaper companies, and so were my staff. But I looked at the NHS chief executives with an interesting eye, I think, and that was, would they have succeeded in the private sector had they been running a private sector business? My last trust, we had 8,500 employees. We were a local trust, but we had 100 different locations, actually spread all over the country for some of the specialist services we could deliver. We had £450 million worth of income, so it was a big business. I'm putting business in inverted.
And do you think those managers would have survived in the private sector?
In where I was, I think a good third, including the chief executive, would have done, and there was a reason for that. They weren't box-ticking process people. They managed the people. But they could walk around the organisation and know everybody by name because they'd been there long enough. And we had what I call the motivational atmosphere was good.
Well, they were just, I'm sorry, that's just to summarise, lose the business speak. They were just good at what they did. I mean, hopefully you're in a situation where you know what people do, you know who they are, and can say, is there any problems today? Right, what do we need to do to solve that? Give me your ideas. Brilliant, thank you, lovely, let's do it. I mean, that's a good manager, right? And we know that so many are not. As you say, they're box ticking. We're told, oh, we can't have a target for this and this and this because then, oh, well, everyone gets treated just before the 4 hours at A&E, but then the person who's already gone over 4 hours, you leave for another 3 days because they're already on the bad stats anyway. Those are bad managers. Isn't it that simple?
Well, they're not leaders. They are just managers. They're not leaders. And they don't have those skills to... I mean, I've always said that, you know, good leadership in any organisation is not about getting people to do what you want them to do. It's getting people to want to do what you want them to do. And there's quite a big difference there. And in some places that works, and there are some good people. I have no issue at the other end of the scale from the small local trust to somebody like the Royal Marsden. I don't even know who the chief executive is, but they should be paid very, very well. It's a world-class organisation, widely respected.
But I thought these people just worked in the NHS out of the goodness of their hearts. Look, I've got got no problem with anyone getting paid well if they're doing a good job, but on the public purse, we need to know they're doing a good job. Is it fair to say that if a particular chief executive, you know, especially someone who's willing to move, and we've had this with teachers, haven't we? Can you move out of your lovely, leafy neighbourhood school, teaching the middle-class kids who turn up after having breakfast and gone to bed at a reasonable time, to some sort of sink school in the middle of, you know, God knows whereville, and yeah, you know what, pay them a bonus to go and do that. That's a great thing. But is it fair to say, yeah, if you've got low waiting lists in your area and this or that is happening, it's good, it's down to you being a good chief exec? Or is a lot of it just simply down to the area where people are running their hospitals and the people who are coming into them?
It is to some degree, and there are other external influences like the local social care provision, where, for example, you've got waiting lists around the A&E because you can't admit people, because you can't discharge other people who are medically fit for discharge. There's all those things. But Julia, can I just comment on a couple of things in Wes Streeting's...
Yeah, very briefly. We're quite short on time, but go for it.
Well, by rewarding excellence, we'll transform NHS culture from top to bottom. No, you won't.
Yep, full point. Fair point.
This will light a fire under NHS bosses to drive better care, improve the experience of patients and build a stronger NHS. Really?
But also, shouldn't they be doing that anyway? No one should be employed at top level in the NHS, I don't know anyone on six figures, who isn't going to work every day planning to do that.
But it's led by politicians who ultimately...
Oh, give me a break. One of the reasons Mick says he wants to go to NHS England is so he can actually do that. Every time I've spoken to politicians about it, they said, oh, that's a decision for NHS England. Martin Gatt, so good to talk to you. I'm going to have to leave it there. Thank you so much, former NHS Trust Chair. Philip Ingram, you were shaking your head through quite a lot of that, weren't you? As an ex-military man, it must break your soul watching how the NHS is run sometimes.
Well, it does, but it breaks my soul watching how the military is run sometimes. I can only come to the NHS from personal experience. You know, I grew up in an NHS environment. My dad was in a hospital board and all the rest of it. But from my own personal experience and going through an inner city hospital when I had cancer, and it was during COVID, that hospital had been put on special measures for poor management and poor outcomes 2 years beforehand. I was very fortunate, and when I came in, they'd gone through, they'd been inspected, and they'd come out the other end as working very well. The neighbouring hospitals were not providing the same level of care that I got in the same time frames that I got. It was a postcode lottery. That's not down to government central funding or government control. That's down to local managerial control in the hospital and priorities and getting things right. And the wokery that a lot of those poor managers are trying to bring in, that becomes their focus, takes them away from what their focus should be. I mean,
NHS
care.
staff, you have to spend time going to sort of diversity training and all that. I mean, okay, we're assuming all nurses and doctors are homophobic, transphobic and racist and you know everything else. Let's let them get on with their jobs unless they commit a serious HR offence against someone. Can we just get on with it? It is mind-blowing, isn't it? I just find there's something just incredibly bizarre about people being told, you know, like, okay, we're now going to have a big change and now we're going to focus on doing our job well. Genuinely, it's immoral. If you are in that job and you are not making sure you're doing the best you can every day, you're immoral. Like, if I do my job badly, the worst thing I can do is libel someone. I'll get sacked. But no one's going to die as a result of it. These are life and death matters.